Hi everyone, Dr. Remy from Pain Free and Fit, and welcome back to our continuing series on stretching exercises to avoid and to include with degenerative disc disease. Today we're going to be going over part 2 in the series, which encompasses local stretches to your lower back. Hope you enjoy. Now, the key with local stretching your lower back with degenerative disc disease is knowing what your unique posture and abnormal mechanical tendencies are in your lower back. If you have a tendency to sit or to move with one hip side tilting or hip hiking slightly, and you're not utilizing that information while you're doing your stretches, you most likely, with whatever stretch you're going to be doing for the lower back, you're going to be actually leaving that area tight and overstretching what's already too loose or stretched out on the opposite side. The same can be said for any type of mechanical instability, whether we have a rotation or twist of our pelvis or ribs, whether we have a translation problem with our rib cage moving backwards or forwards, or our hips from moving side to side. You need to understand what your unique tendencies are, because that's what you want to target with your stretches. Otherwise, you're going to be overstretching what's already loose, and in degenerative disc disease, that's a big part of the problem, because as the disc thins out and comes together, certain ligaments and soft tissues are going to be getting too much slack. They're going to be becoming too loose. And if you're overstretching that mechanically is actually irritating your degenerative disc problem instead of helping it. We want to target what's actually tight in the local region of the lower back. We have many therapists, doctors, and trainers here on the North Shore of Long Island that still aren't utilizing this type of knowledge with their stretches that they give to their clients and patients. And that's unfortunately a problem. I have patients coming in from Manhasset, Garden City, Locust Valley, Glen Cove, even from New York City and New Jersey, who have been given tear sheet generic stretching exercise programs, and unfortunately they wind up doing more damage than good because they're stretching their spines in an inappropriate manner. So let's get in with contemporary rehab for degenerative disc disease, knowing that stretches need to be customized for your unique posture and individual mechanical issues, and we're going to get a lot more results. So without further ado, let's go into some of these typical mistakes and stretches that we need to do. Number one, if you have determined that you have a tendency to either lean your ribs more to one side than another, or to elevate your hip one side more than another, and again, you'll know this because you have to go through a full body analysis. We have one for free on the Pain Free and Fit website, as well as the posturesize.com website. You'll be able to target what side needs to be tighter. Now, it's good to go through that analysis, but to save time, if you don't have time to go to the analysis now, you can do a short analysis on your own and just swing your hips down on one side and to the other. And you'll see that one side will generally feel a little tighter compared to the other. Same thing if leaning your rib cage to one side or another feels tighter. You may also feel pain is provoked to one side. So obviously we don't want to be stretching that side. We want to be stretching away from any side of pain. We like to stretch in terms of lateral flexion or side tilting without the discs being compressed. So when you have people at the gym that are stretching, tilting sideways, even worse, holding a dumbbell and doing lateral flexion strengthening exercises, as you come down, you're actually loading the disc and stressing it. That's going to create more degeneration and problems. So we're going to go onto our hands and knees for this stretch. And let's say that I've determined that my right side is the tighter side. It's the side that I typically stand with one leg out or raise a hip on, or have a tendency to lean to, or in my self-exam I notice that I can't exactly stretch as far going away from that side as towards that side. Then what I want to do is, on the hands and knee position, I want to swing that right hip down away from my rib cage on that side and walk my hands off so that my upper body turns away from that side. That's opening up that side of the disc compression, which is stretching it because it's beneficial. That's the tight side. And it's closing the other side that's actually too loose. That's going to help normalize the pressures inside your disc. If you do want to come back to the other side, you're not going to go as far. You're just going to go a little tiny bit to feel the stretch on the opposite side. But more of your stretching is going to be emphasized, targeted to your unique problem, which is that one side that's tight. We can also stretch in lateral flexion in a seated position by using a posting technique where we take one arm out. Again, this is the side that I want to open up because it has a tendency to close. So I would sit down and I'm going to lean my elbow towards the bench, allowing my upper body weight to come to the side, and all my upper body weight's being supported by my arm. That's a lot different than doing this where the muscles can't relax. They're going to be tensing so I don't fall over. This way I'm properly supported. The muscles in the abdomen, the rib cage, and the back are all relaxed. I can stretch not only the muscles, but the other non-contractile soft tissues like disc fibers, ligaments, and joint capsules as I go this way. Seated stretches are reserved for those people that don't have discs that are actively bothering them as much. When you sit, you're going to put 12 to 13 times your body weight on the disc, so this is going to be more compressive versus a hands and knees stretch. What about if you have a rotational problem? There's a lot of people that have a tendency to turn one leg out more than another when they stand and they walk, and as a result, the pelvis likes to turn the opposite way. Many times the rib cage will turn that way or turn the opposite way, so that there's a torque in that disc. If we're not taking this unique consideration in mind with you as an individual, when we stretch in rotation, we many times will be stretching both sides and actually going further into the side that's already too loose. That's, again, aggravating disc fibers. We're stretching what already is too loose to begin with. So let's say I've determined in a seated position that I can turn much easier to the right than to the left. That feels stiffer. So obviously, this stretch on my local lower back from my rib cage to my pelvis needs to be emphasized coming this way. Here's the key with stretching rotation or twist in the lower back. The lower back's not designed for a lot of twist, and most of the time when you have difficulty twisting one side, it's more your mid and upper back that's actually tight. So what we want to do is protect the lower back by keeping our belly button and pubic bone vertically aligned with one another as we twist our shoulders to one side. Now again, this is the side I want to emphasize. If I twist too far and allowed my belly button to move with my shoulders, it indicates that my lower back is starting to twist in that direction, and that could be a problem as well. So you could put your finger in one belly button with one finger and on your pubic bone with the other, and as you twist, you're going to make sure that belly button doesn't come along for the twist. It stays behind so it's still facing straight forward. You can use this technique laying down as well. If you notice that you have a tendency in your local muscles of your back, your abdominal muscles and your back muscles are tight, making your knees fall to one side or another, one side is tighter, that's the side we want to stretch to, but we want to keep the belly button facing straight forward. Again, keeping your fingers there will help you with that rotational stretch. Many times with disc problems, the disc is compressed with flexion. Because people have a tendency to sit, slump forward, drive a lot, they have disc pain when they're bending forward, the spine is intolerable to flexion or bending forward. The front of the disc gets compressed when we come forward. So stretching and extension or backwards bending is actually very good for the disc. Now this differs from people that have, say, spondylolisthesis or stenosis in the lower backs, where extension could actually aggravate them. So again, you have to be unique for your unique situation. You have to have a unique stretching or exercise program. If we use a hands and knee position, again, to stretch an extension, which is generally healthy for most degenerative discs, we can lift our tailbone upwards and lift our chest and head up a little bit. This creates a little curve in my back. You'll see as my stomach falls down, my lower back starts to arch. And again, I'm going to use a comfortable degree of extension stretch. Now, while I'm doing that, I'm also thinking about my other corrections that need to be targeted with this stretch. If I have a tendency to hip hike or raise one hip up on one side, or lean a rib cage down, or have a twist, I want to include those corrections as I'm using this extension stretch. I want to make sure my hip is not moving up or actually hold it down the other way, lean my rib cage away the other side as I come down. I can cycle this stretch from 2-second holds, where I hold for 2 seconds and then come out of it, and come back for 2 seconds, all the way up to holding for 15 seconds up to 2 minutes to really let those deep fascial structures that attach to the disc, the joint capsules, and the myofascial system in your lower back get a good stretching. I can also do this passively lying face down by using varying degrees of extension or lift. Again, I want to make sure that my lower back is in the correct neutral spine position. Again, if you don't know what a neutral spine is, that's the safest zone for your lower back to be positioned in. We teach that in our Fast Track Healing Exercise program that's coming out on our website. We're really excited about that over the next 2 to 3 weeks. As well, this type of knowledge is available to some degree on our other videos, on our Pain Free and Fit channel here, or through our products at the Pain Free and Fit website. If you position your spine so it's in the neutral or most safe position, you'll begin extension stretching by raising your chin and letting it just rest on your hands. Again, you only want to create enough arch in your back for it to be comfortable. We never want pain. If that feels comfortable, we can come a little higher and we can put our forearms down. Now here, my elbows are slightly hanging off the bench, so I'm not as tall as bringing my elbows underneath me. That's creating now more of a stretch in the lower back. Rarely do most people need to go higher than that by straightening their arms. That creates an excessive amount of extension. So for most people with degenerative disc problems, just keeping the elbows underneath the chest is enough of an extension stretch. We can also use a decompressive stretch with the lower back, where we take 2 chairs or a dip station and we engage our RPI, or reverse posture isometric, to hold our spine in a neutral position as we simply hang and let our body sink from a hanging position. Now, if you're not strong enough to support your whole body weight on that, you can also do that on an exercise bench or a chair at home, where you simply sit down with your hands on the edge, allow your hips to drop forward, and now your legs are helping to support you, and let your spine just kind of hang from your shoulders. Now, the problem is a lot of people that teach traction, and you'll see a lot of devices that are available on television, they're never talking about your specific alignment as you're actually decompressing the spine, or the length of time. If we have a spine that's degenerative and too stretched out, and we hold it for more than 30 seconds at a time, we can actually cause an overstretching of those fibers that are already overstretched. That causes a biomechanical phenomenon known as creep, where the ligament gets permanently overstretched for a length of time. You don't want that. That's going to create more instability in your back and more aggravation to your degenerative discs. If we're not holding our unique body posture while we're decompressing, that also is creating a problem. If I just hang generically from here without thinking about my unique posture, I'm not targeting the actual tissues in that disc, the fibers that are actually tight. I'm just taking the whole disc and stretching it out, and most of the time I'm actually holding myself in a little distortion and further stretching the fibers that are already too loose. So I want to engage whatever my corrections are. I may need to twist my pelvis or my ribs to one side. I may need to hold one hip down or one rib up. I may have to engage myself in a forward to backward or side to side way to create that neutral spine. Once I have that unique correction for my body, now the stretch is going to be targeting those disc fibers that are tight for my unique situation. When we go into stretches, we should come into the stretch whether we're using chairs, a dip station, or a chair at home with our hands on it and our feet still supporting. We should only do that for maybe 2 to 30 seconds at a time, and then slowly come out of that as you put pressure back on the disc. If you come out quickly, that change can actually aggravate your lower back pain. So a good technique to use is simply 5 to 10 seconds of a hang, slowly come out, rest for 5 to 10 seconds. Again, engage your position so it's unique for your body, the corrective RPI, your neutral spine position, and then go into the stretch again. So you can do anywhere from 5 to 10 repetitions of that. And I have many patients that find by using that stretch once or twice a day, it really helps to decompress that disc, stretch the targeted tight tissues for that unique person, and provides a lot of relief from their pain. So again, make sure with any kind of local stretching to the back, you're keeping in mind what your unique issues are. Have a full body analysis. If you have a trainer, if you have a doctor, if you have a therapist you're working with, and they're still giving you generic exercises, generic stretches, find someone else and ask them to do a good full body analysis if they have that knowledge, so you can target your unique spinal degenerative process as a unique person. Otherwise, generic stretches many times are going to stretch those tissues that are already elongated further in your aggravation. I hope you've enjoyed this video on local stretching. If you have any questions or comments, please feel free to leave them below. I'll do my best to get back to you. If you like this material and would like to help me share it with others, give me a thumbs up below. sign up and be part of our ongoing system by subscribing to our channel here. And I hope this video helps you with your degenerative disc condition.